PJ, when he was born, wasn't eating very well. He was always in some level of distress physically, unfortunately with a failure to thrive. That was the diagnosis. I mean, there was a host of things that were problematic for PJ. After that diagnosis of failure to thrive had gone by the wayside and had subsided, PJ was a normal, happy, healthy young man. It was when he got into high school, we started seeing some things that caused some concern.
They said, PJ, we need to get you checked out and looked at.
We were eventually able to determine that he was suffering from schizophrenia. It created a number of problems for him. And then eventually, as a matter of course, he became homeless. I constantly worried about him every day. Sometimes I didn't even know where he was.
I was sleeping under a bus stop. One time, somebody from Crisis Center grabbed me, said, man, you gotta stop doing this. He always said, yup, Paul, come on in, come on in.
The people at the walk-in center reached out to me, and then we would have conversations around what's going on with him at the time and how things could get better.
I was in a crisis, and they helped me out.
PJ would tell me about the walk-in center, or he would tell me about the things that he would learn, what was available to him, and then he would take advantage of those things, and then he would share them with me, and you could see the smile on his face when he saw, okay, I'm going to probably be able to get that much better. He would not have been able to do that had there not been the support from the mental health center, from the walk-in center, from his family support, and all those kinds of things.
They treat me with nothing but love, respect, and honor.
It's time for him to move on. And then it was like, okay, but where does he move on to? The Sanderson's goal is to address those individuals who have a history of homelessness. My son was one of those people for years. I don't think he would have gotten there had it not been for this collaborative effort. He is so proud of what he's accomplished. He wants to be a contributing person in society. He wants to be respected. He wants to be able to demonstrate that he's not the same person. And he works hard at that. He works very hard at that. And I think he does a really good job.
MSCD's helped me out a lot. Without MSCD, I wouldn't have a place to live right now.
I can't thank the entire system enough for that.
MSCD is one cool place. I wouldn't have the food I have in my house now. I wouldn't have a job. I wouldn't have no money, but MSCD is cool. I'd be dead broke.
At the end of the day, why he has made it, having to learn how to survive, get help when he needed it, the walk-in center being there, family members being there, and then him finally learning, it doesn't always have to be this hard. And I can probably do a lot better on my own once I know how to do those things. And he's learned that from an entire community.